NDTV's gone beyond daily news coverage to lead impactful campaigns that have driven awareness and tangible change in the health sector. इस कैंपेन ने देश में ऑर्गन डोनर्स की कमी को हाईलाइट किया और पूरे देश में चर्चा को बढ़ावा दिया, प्लेजेस को प्रोत्साहित करने और नीति को आकार देने में सफलता प्राप्त की। अब एनडीटीवी इंडिया हेल्थ मिशन के साथ इस कमिटमेंट को एक कदम और आगे बढ़ाने के लिए तैयार हैं। In its second season, the campaign aims to bring renewed focus to the country's most urgent health challenges, promote preventive care and foster collaborations across the public and private sectors. And by leveraging its trusted voice, NDTV continues to play a crucial role in shaping a blueprint for Health Vision 2047. We begin the NDTV India Health Mission Season 2 with a power-packed panel discussion. The topic for today is Health Vision for Viksit Bharat 2047, and we will be discussing the blueprint for the health vision needed for a Viksit Bharat. Our guests on the show today on this very, very important issue, we're joined by Dr. Ashutosh Raghuvanshi, MD and CEO, Fortis Healthcare, Dr. Puneet Mishra, Professor Community Medicine, AIMS, Dr. Reggie George, founder, Tribal Health Initiative, and Dr. Amrish Mittal, Chairman, Endocrinology and Diabetes, Max Healthcare. Thank you so much all for joining us on this very important issue, on this very important program. I'd like to start first with you, Dr. Raghuvanshi, if I can begin with you. And despite increased awareness, the uptake on preventive health, however, remains very low. How can we shift people's behavior from reactive to proactive? What role can Fortis play in this?
Yes, Gargi, you are right that there is nothing better than prevention, and prevention is going to become a part of people's lifestyle only with the awareness. So I think awareness is the most important thing. People are getting more aware about prevention than what they were before, but I think there is still a long way to go. For a country like us, I think preventive care has got not only a medical connotation, but it is also an economic imperative, because the cost of providing care and providing outcomes, especially in chronic diseases, etc., is very difficult. And the more prevention is done, the better are the outcomes and the better, healthier people would be. So in this front, we as a private organization have played a small part. We work on a lot of initiatives of awareness. However, we have also started certain screening programs which are community-based. The larger community needs are something which a private organization cannot fulfill, but we can definitely contribute. So we are doing some early screening of cervical cancer and breast cancers in some parts of Haryana. And we have also started doing some awareness programs in schools. As a part of our CSR initiative, we have started working with some of the rural schools where we are providing smart classrooms, etc., the toilets and drinking water facilities, etc. So we are taking that as a base to be able to teach students or inculcate, the good habits in terms of how they take care of their lifestyle, because it is all about lifestyle. There are various levels of prevention. Of course, in chronic diseases, there is another paradigm where it is important to prevent complications, etc. Whereas at the same time, in general, it is important that the role of exercise and lifestyle, especially diet, smoking, cessation, control of weight and control of blood pressure, diabetes, etc. All these things are important. And if you inculcate these values in children, I think they take it home, they take it to their parents, and that's how it will be spreading. Right. And I think the role of media has been very good. NDTV has done fantastic work in past as well, and I'm sure they'll continue to do so.
Well, thank you so much for that. And an important point you made that we have to start this young, inculcating these right habits, this kind of awareness. And I'd like to talk more about creating awareness because even when there is awareness, we still see that behavior, however, of society doesn't change. Dr. Puneet Misra, to you, हमारे behavior में या society में कौन से बदलाव लाने की ज़रूरत है कि ताकि पहले से ही सेहत को लेकर हम alert रह सकें?
Thank you. It's a question which you have posed that क्या changes लाने हैं अपने behavior में. बहुत वाइड सवाल है क्योंकि इंडिया इज अ कंट्री विच आर डीलिंग विद कम्युनिकेबल डिजीजेस एज वेल एज नॉन कम्युनिकेबल डिजीजेस एंड फॉर डिफरेंट डिजीजेस यू हैव टू चेंज बिहेवियर like for example if we say for communicable diseases or infectious diseases हमें हमारा खाना पीना कैसा है हम ऐसी कौन सी चीज़ कर सकते हैं जिससे इन्फेक्शन नहीं हो साफ़ पानी चाहिए जिसके लिए भारत सरकार ने जो है मिशन चला रखा है जो कि स्वच्छ पानी मिल सके सारे लोगों को उसके साथ ही साथ सैनिटेशन की इश्यूज आते हैं जिसके लिए अवेयरनेस है और बहुत ज़रूरी चीज़ अभी जो है देखा जाए भारत में नॉन कम्युनिकेबल डिजीजेज बढ़ रही हैं यानी कि वो बीमारियां जो कि इन्फेक्शन से नहीं होती हैं दोज आर मेनली लाइफस्टाइल डिजीजेज लाइक डायबिटीज़ लाइक हाइपरटेंशन ओबेसिटी एंड फॉर दैट there are risk factors which are really important and what happens that these risk factors should be we should work on these risk factors early in the life like for example if our lifestyle is not good if our food is not good if we are taking a lot of fat then it is going to convert into disease after so many years. So what happens that people usually for the non-communicable disease, they don't, feel that kind of risk that they do have. Suppose if somebody is not doing exercise, taking high calorie food, taking a lot of fat. So after a few years, they might develop diseases like diabetes, hypertension, obesity, and others. So I think that is important. Let me give you one example of awareness, how Government of India has worked, which is a successful example. If you remember that in 90s, it was said that India is going to be the capital of HIV/AIDS in the world. Because at that time prevention was the only cure which was available. But with the effort of Government of India, NACO, now if you see the prevalence is less than 0.3% in the adults. So we have come long way. Prevention is something which is really important if you have to, deal with the diseases, especially non-communicable diseases where the risk factors, they start early in the life and we have to do on that. Other thing is about the vaccination, which government is doing from the childhood for different diseases, which has prevented many communicable diseases in the country. So awareness generation is important part. And it is important for both communicable disease as well as non-communicable disease.
Right, doctor, many important points you raised there, especially about diabetes. One hears from the medical community constantly how this is a big, ticking time bomb. Also, aapne baat ki vaccines ki, and I just have to be, thankful we don't have that culture of anti-vaxxers very prevalent in this country. So that's, something to be grateful for. But Dr. Raghuvanshi, back to you. Fortis ka bhavishya aur iska expansion India's Health Vision 2047 के साथ कैसे मेल खाता है?
So, जैसा कि प्रोफेसर मिश्रा ने कहा कि नॉन कम्युनिकेबल डिजीजेस का लोड बढ़ता जा रहा है तो इट इज इम्पेरेटिव दैट फैसिलिटीज फॉर सच डिजीजेस आर क्रिएटेड. So we also, just like others, have been focusing on creating infrastructure, especially for cancer care, as the incidence of cancer is increasing and the early diagnosis is improving. And as a result of that, of course, the outcomes are also improving. But it requires high-tech care and requires a lot of high-end infrastructure as well. So we have been building that infrastructure. But more than that, I think on the preventive side, we are also working on one of the things which Professor Mishra mentioned is the vaccination. Adult vaccination is one thing which in the country has not been that popular. And we are putting up vaccination clinics in various hospitals and outside of the hospitals as well in the community. And those are some of the initiatives. Other than that, one aspect of health which is quite ignored at times is mental health. So that is another area on which Fortis is working very seriously. We are creating the entire spectrum of services, which includes an online counseling service, which is sort of anonymized and people feel comfortable using it. So that we are developing along with some of our partners. And also we are developing inpatient services and other services on the mental health front. So these are some of the areas. Ironically, what I have seen is that the classical healthcare industry in India talks only about sick care and not really about health. So
And
I think that
prevention.
paradigm needs to change. And for that, we are focusing a lot on the preventive health checks, etc., as well. So we are thinking of putting up some of the standalone preventive health centers as well.
All right, very important points then. Yes, that old adage, prevention is better than cure, definitely is something that we need to emphasize more in this country. Dr. Reggie George, given your experience, what policy level interventions are required to ensure that rural and underserved areas benefit equally from these preventive health programs?
Okay. See, what I think is at the planning level itself, we are planning at the national level. And planning at the national level is like one size fits all. And that is a big problem because when you are planning for Gurgaon and you expect it to work in a remote village in Jharkhand, it doesn't work. So the whole the outlook towards planning has to be decentralized, which means we have to have not even state level planning, we have to have district or taluk level planning, because unless you understand the local needs and the local problems, you will not be able to find local solutions. And this is one of the main things which affects our health system. Our planning is completely skewed because, and the second thing is our planning is when you're planning for health, you never involve other departments. For example, roads or food, or economists. When you do health planning, you have experts in health sitting and thrashing out things and not taking into account the other social determinants of health, like jobs or roads or water and sanitation. And this also has to be done at the local level. So this is one of the biggest flaws. No doubt we have made huge improvements, because I've been working in rural and tribal populations for more than 50 years. So I know that there is a huge change. But I think the change can be much faster if planning is at a local level. And I'm not sure whether the center or the state wants to give it up, but that is the biggest, I think, thing to be changed.
Okay, very important points you made there, Dr. Reggie George, especially given your experience in these areas and taking from there maybe something that Fortis and Max too can think about. Dr. Ambrish Mittal, I'd like to come to you now about how to encourage this preventive health care and create more awareness about it, and also at the same time, how do we incentivize doctors and medical staff to work in underserved rural areas? This has always been a big challenge.
Yes, thank you, Gargi, for having me here. First, we need to understand the basic genesis of chronic non-communicable disease. And if you have to choose one factor, that is excess body weight. Excess body weight is what drives diabetes, hypertension, heart disease, strokes, and even some types of cancer, all kinds of arthritis. So as a society, our focus has to be on avoiding excess body weight. I need to explain that a little bit. It's not just excess body weight, it's also the way it is distributed. In India, for example, people may not be overtly obese, but they may still be having excess abdominal fat. Within India, as has already been emphasized, there is a whole lot of difference between different areas, geographical regions, within the same city. A very striking recent study in Delhi schools done by the AIMS actually showed that the prevalence of overweight in Delhi schools was about 13% overall. but it was 5 times greater in private schools as compared to government schools, 5 times greater overweight. Okay. Similarly, when you talk of undernutrition was 5 times more common in government schools as compared to private schools. So India is dealing with both together. Optimum nutrition and one size will not fit all, even within the same geographical region. So we need to have optimum nutrition. That is the public health way to deal with it. And it doesn't start in childhood. It starts earlier. It starts during pregnancy. It's been very clearly shown in studies from Pune that if the mother is either malnourished or obese, both ways the child will be more susceptible to diabetes and hypertension and heart disease later on in life. So I think these are the important things. So we need to spread awareness, as everyone is saying, no question, but awareness has to be at different levels. It's not that we can't transfer the responsibility to the individual per se alone. Individual, of course, has to be made aware about what is healthy, what to eat, what not to eat, what lifestyle measures to take. But also there has to be change within the family. We see patients who come in where everyone is overweight or obese and they only sort of, everyone's focusing on the patient, the one who's got diabetes and hypertension, not realizing that he's also eating the same food or she's also eating the same food as the rest of them. So individual, family.
Right.
Society is very important. Communities within, RWAs and other communities have to emphasize. We have in Delhi, for example, we have gyms in most parks, but I think they are grossly underutilized. Government installed gyms. All facilities are there. A lot of facilities are there. We can't say that we don't have access, at least in some parts of India, right? And then you go further. It also has to stretch to authorities. So we have to make sure that when we say don't have unhealthy food to school children, what options do they have in school? Do they have healthy food options in school? So if we don't provide healthy food options, how will children or youngsters go for healthy food? Right. So we can only remove the unhealthy food when we have healthy food options. And 2 more points here I'll make before I hand it back to you. What is important is that healthy food options should be cheaper than fast food or junk food. Healthy food options have to be cheaper, more accessible, more widely available. That is really, really important, but that doesn't happen all the time. Availability as well as cost. Cost is a big determinant of what people eat. And second, of course, is that we can tax things in a greater way, right. Things we know are clearly healthy.
Right. Sorry, Dr. Mithun, for interrupting you. We're running out of time and lots of topics to also cover in this program. But yes, important points. You didn't talk about how we can encourage doctors to work in rural areas, but we'll talk more about that. Time for us to slip into a short break. It's a very important issue that we're discussing, preventive healthcare. We're also going to talk about technology coming up after this short break.
Do you really know the company you invest in? What is the real picture behind presentations and claims? Is the outlook as rosy as the company claims? Know Your Company, powered by NDTV Profit Research, shines a light on the biggest stock market movers.
How often have you turned away from debates that descend into endless fights? We bring you a show where every question is answered, where every debate finds its resolution, where every story finds its conclusion, where opinions collide but facts prevail, where stories unfold with insights and trust. When the noise ends, the last word begins.
If it matters to you, if it matters to you,
If it matters to you, it matters to India. It matters to India. And it matters to me. And it matters to me.
India Matters with Shivaru. Only on NDTV 24/7.
I've been reporting on all issues big and small from Andhra Pradesh, Telangana, rest of South India, bringing you all the action, all that you need to know, all that you want to know.
The energy of maximum city is infectious. I'm bringing that energy in our news coverage from financial capital Mumbai.
Covering from the southernmost part of India over the last 23 years, I bring in-depth and 360-degree coverage from the Dravidian heartland.
The land of Mishti, also known for its bitter politics. I have seen much water flow under the Howrah Bridge, covering Bengal in all its vivid colors.
India's IT capital is always bustling, a city full of startups, stories and surprises. And I keep you ahead on all the Bengaluru buzz.
In today's interconnected world, India's voice is more crucial than ever. When India speaks, the world listens. At NDTV World, we are that voice, bringing you intelligent and insightful news from India and beyond. From geopolitics and diplomacy to economic shifts, migrations, tech disruptions, and the stories of our diaspora. We cover the news that shapes our global future. NDTV World, your new home for global news is here.
मैं नरेंद्र दामोदर दास मोदी ईश्वर की शपथ लेता हूं कि एनडीए सरकार में हम अगले 10 साल में विकसित भारत के सपने को साकार करके रहेंगे। अटल से तो विकसित भारत की तस्वीर है। प्रेरणा और प्रगति जब एक साथ जुड़ते हैं,
Welcome back to our special show on the India Health Mission, and we're talking about urgent steps that need to be taken for a healthy India. Well, let's go back to our guests, and now we want to talk a bit about technology. Dr. Raghuvanshi, and I'd like to pose this question to you. If you could tell us, how are new technologies helping in health innovations to make it more accessible?
Yes. I think there are two Indias, as pointed out by everybody, and the regional differences and accessibility of geography, accessibility on the economic level, and there are multiple barriers to access. So definitely technology can bridge some of those gaps, not entirely, but to a large extent. Especially the primary care can be delivered remotely especially in inaccessible areas. And there, I think the role of eSanjeevani, the government's initiative, I think can become a very, very important delivery tool. But other than that, I think technology has multiple roles to play. One of the things which I personally feel is that in the healthcare ecosystem of a country like India, we cannot afford any wastages. And until the entire ecosystem is integrated in a manner that, the patient has investigation once, then they go for further treatment, etc. All those longitudinal records, if they are available, so which is part of the National Digital Health Mission, to create these ABHA IDs and have all the records being accessible to the patient at one click. So these are a few initiatives which I think are going to transform the way the care continuum is provided, and that will remove the wastages from the system. So these are two initiatives which come to on top of my mind, but there are many other technology-related areas which are going to improve the way the healthcare is delivered, especially the decision support systems, artificial intelligence-related areas in diagnostic, for example. All these things are going to make a major difference in how care is made more accessible.
All right. Well, I'd like to get Dr. Reggie George back here. And given your experience, sir, what role do private and public-private partnerships do you think play in bridging this healthcare divide between states and regions?
Okay. I'm also just continuing from what was spoken earlier.
Yes.
See, what is happening is our tertiary healthcare system is excellent, is world-renowned. And there are a lot of private players, but there are also government players. Government players not to such an extent. Our primary health care system over the years has developed really well, even in the most remote areas. Now, the huge gap is the secondary care system. For example, if a person has to have a very simple surgery, for example, a hernia removal or a uterus removal, a hernia surgery or a uterus removal or an appendix, this comes into the secondary care slots. Now, the secondary care slots is not funded by the government. The Prime Minister's schemes don't cover it. The Chief Minister's schemes don't cover it. And the taluk hospitals, which are supposed to deal with this, or the bigger PHCs, which are supposed to deal with this, have no way of dealing with this because either the surgeons are not there or the anesthetists are not there. And this space is taken up by private hospitals all over India. And I feel that is a big gap because a lot of patients, it's not like people accessing tertiary care, where the numbers are small. The persons accessing secondary care is a huge number. And there are only private players there. The government has not yet got into planning for secondary care.
All right. I'm so sorry, Doctor. We're completely out of time here. But these are conversations and discussions that we are going to continue to have on this campaign, NDTV India Health Mission. Thank you so much for joining us. And thank you all for watching at home. As we said, we're going to continue having these very, very important conversations. Thanks for watching. Goodbye.
The last 1 month, if you see, the share prices of Genzol Engineering has fallen more than 58%.
Why are the rating firms calling the debt payments as default?
We have two credible credit rating agencies on March 4th coming and downgrading the stock to D.
Statements are consistently being proven wrong, and transactions are being taken place which are different from what they were originally pictured to be.
The company claimed it would roll out 6,400 electric vehicles. But what it has rolled out is a shocking scam. Funds meant for the project were funneled allegedly back to the promoters, the Junkie brothers. What did the money buy? Not EVs, of course, but a lavish flat in Gurgaon's luxurious DLF Carmelias.
News is not just headlines, it is what impacts you. And news should never be mistaken for noise. What matters is the reality. Accurate, in-depth, and with the right perspective. For over 20 years, I have been a journalist, and never has clarity mattered more than now. At Newsnight, we go beyond the surface. We dissect the details, challenge the narratives, and bring you the unparalleled clarity you deserve in a world clouded by misinformation. We are bold, we are direct. Newsnight, for the news in your interest. Only on NDTV 24/7.
After 2 years of the India calendar,
Hello ladies and gentlemen, you're watching NDTV. Civil Aviation Minister Ram Mohan Naidu in his first media briefing after the Air India flight crash in Ahmedabad has said that the black box data from the Air India aircraft that crashed is being decoded, while multiple agencies and high-level panels are conducting an extensive examination of what really the flight went through. Also, he said that there have been strengthened security protocols that have been put in place. We will discuss all that and more, but first up, the headlines. A high-level team led by Home Secretary to probe the crash. 3 months deadline set for this probe team. Minister Ram Mohan Naidu says black box has been recovered and that will provide in-depth insight. Boeing 787 under lens now, and this is after the plane crash. Government has ordered extended surveillance of Boeing 787 planes. My colleagues Ankit and Aishwarya reporting from ground there. Plane's tail has been shifted, only intact part of Air India 171. One more body recovered from the tail portion. Boeing whistleblower speaks exclusively to NDTV, says indication of dangerous manufacturing. Meanwhile, Israel and Iran have traded missile attacks. Iran has retaliated, 3 killed in Israel, 78 killed in Iran as Israel continues assault. Well, debris clearance is underway in Ahmedabad at the Air India plane crash site. This is where the plane collapsed. The tail portion is being removed with the help of cranes. Another body has also been recovered from the tail portion. The death toll now stands at 275, including the medical college students and doctors who lost their lives at the time of the crash. As DNA matching efforts continue, remember the sampling and testing efforts are underway at hospitals in Gandhinagar and Ahmedabad. The probe team has also arrived at the collapse site to investigate the crash. We've been bringing you visuals and voices from the crash site. The plane's debris, remember, was strewn all over the medical college hostels complex. In fact, the tail was lodged on the ceiling of the mess and one of the tires was also stuck in a ward. The tail is the only intact piece of the aircraft and is extremely critical for the evidence for investigation. My colleague Ankit joins us with more details on this. Ankit, if you're there, help us understand what really is happening today and which are the teams that are working on removing the debris, and also what is going on with respect to ensuring that the tail portion is picked up and shifted. Okay, these are the live shots there. We are trying to get you, Ankit, in just a bit. The live shots of what is happening at the debris site. This is the collapse site. Remember that when the plane crashed at BJ Medical College and Hostel, this was the mess part of the hostel where the plane crashed, and the plane's debris were strewn all across the hostel complex. The tail was lodged on the ceiling of the mess, and it was this portion of the flight that had actually brought in a lot of injuries and also led to deaths, and it also led to an explosion. Students present in the hostel complex at that time, at the time of the crash, and all the rescuers, the first responders who had come in, who had reached the spot then, had said that the plane had hit the mess tail first